welcome back to Thrive Alive. I am your host, Nurse Jazmine, and I'm happy to have you for another talk for the entire community. We are celebrating Father's Day, and in celebration, we want to continue the conversation to discuss positive developments in the response to health disparities as it relates to the Black family. We want to talk to our guests today about the work that is being done to engage Black fathers during prenatal care and beyond. Before we jump into the questions, I want to introduce our guests. Dr. Julian, why don't you start us off by telling us more about your role at Rush and how you came to research Black fathers?
I would love to do that, Jazmine. My name is Wrenetha Julion. I am a professor in the College of Nursing and a researcher. So my research has focused on Black fathers and supporting their involvement with their children, especially for dads who don't live in the home with their children. So I got interested in this when I was pursuing my doctorate and in the community, and I didn't know what I wanted to do, but as I was moving along, taking courses and being in the community, I was waiting for this light bulb moment to come and say, this is what you're going to study. And so I was involved in a fatherhood evaluation project in the community where there were 2 community organizations that were doing fatherhood work. And as I worked with those 2 organizations, my light bulb went off and I said, this is my group for African-American dads not living in the home with their children. Okay. Because that's the group that receives the least attention but gets the most grief, if you will, with regard to their children. So that research, I also am the Associate Dean for Equity and Inclusion right now in the College of Nursing, and really just happy to support efforts to increase diversity among the nursing profession, amongst all students, and I'm really excited to be with you today.
I'm so excited to have you. You wear many hats, Dr. Julian. And you wear them well, might I add.
Thank you.
Dr. Santosh, talk to me about your interest in this work and how you and Dr. Julian came to do this work together.
For sure. Glad to. Hello, everyone. My name is Santosh Basapur. I'm a PhD in systems design from IIT Institute of Technology, and Institute of Design is my alma mater. So I am an assistant prof in family and preventive medicine, and I have been doing research in how do you apply human-centered design to systemic issues like the Black maternal mortality. In another project, I'm applying it to how do you increase participation of diverse populations in translational medicine, which is clinical trials.
Okay.
Like how do you get people to participate in the science development? Because without grassroots participation, it's going to be hard to design the right solutions for the right people.
Right.
So that's how I got into this. And last year, thanks to Dr. Julian, she was on a panel that we designed as part of a Black maternal health event. Like we did a World Cafe to have community members and researchers and students ideate around what solutions can be created for Black maternal mortality issues. And she was our main panelist. And we got talking and we started sharing ideas, and she's like, can we work on something together? And I'm like, I'm definitely glad that you asked and I want to join you. So she then made me aware of the issue of how underrepresented or undervoiced the Black fathers are in all this. So that really got my attention, and we started working on that. Because design has been used in the industry, like in corporate America, for like furniture design, toothbrushes, right? But nobody has adapted those techniques nicely to start saying, how can we get the voices of people out in the community and literally have them design the solutions for themselves, and we are just the facilitators. So then that discussion got us to where we are, and we're trying to do these projects for Black fathers now.
Awesome. So human-centered design is exactly what you said,
yes,
where the participants are helping to design the solution for themselves.
Yes, it's about, with, and for people.
Awesome. I love that. You would think that's how it should have always been, right? But unfortunately not.
Unfortunately not, and Dr. Julian and I are really trying to make it that way.
Awesome. Awesome. Well, thank you so much for those lovely introductions. We are going to dive right into our questions. We have some very good material for you guys today. The first question I have is, how do negative stereotypes about Black fathers' involvement in the home affect the overall family's ability to receive adequate care? Did these stereotypes influence the way you decided to study Black fathers' experiences transitioning into parenthood?
Well, I would say a couple of things. The stereotypes are fueled by the media. Probably 50 years ago, there was a report that came out called the Moynihan Report that talked about the Black family, and the number one factor that was considered to be a negative impact on the family was fathers and fathers' absence. And so going that far back and just looking at the media and what we hear about fathers is so often something that's negative, particularly for Black dads who don't live in the home. So with that big stereotype, I have to say, when I was a student and I was looking at data and research, this statistic sticks in my head. 2/3 of all African American fathers live outside the household with their children. And where are these data coming from? Who's obtaining these data? And what I've learned along the way is that the data is coming from everyone except fathers themselves. So you have researchers who are asking mothers about fathers, researchers who are asking practitioners about fathers. And there was also this stereotype that, we can't ask fathers themselves because we don't know where they are. We can't reach them. Like, okay, so now we have invisible fathers.
Right.
So that work really started my research in this space, because the one thing I said that I was going to do is ask fathers themselves. So that's how I started out as a student, with, conducting my research and conducting it with fathers to hear their perspectives. And that really feeds into where Santosh is with human-centered design, because how can you just randomly come up with solutions for people without actually talking to them?
Right. Wow, that's interesting. You said 2/3 of Black fathers don't live in a home, according to that report.
That data, Moynihan
years ago.
might have been worse, but this was about early 2000 when I was doing the early work for my dissertation, because I finished in 2002. And the other thing is, I kept hearing about these data. So I'm like, okay, so when is somebody going to do something about this?
Right.
So the one thing that I knew as I was continuing to pursue my research was that I was going to be intentional about doing something, creating an intervention, working with dads to do something, as opposed to just keep parroting this statistic over and over and over again. So that's what really drove me to the place where I am, is I'm like, I'm tired of people saying this.
Right. Wow. That's crazy. I just want to go back to the human-centered design and just reiterate how important that is, and just thank you guys ahead of time for doing this work, because it really is important. Like you said, how can we come up with something for someone without talking to the someone that is for? So, okay, next question. How does stigma affect the experiences of Black fathers during delivery and postpartum admittance in the hospital? So specifically in that hospital period, where mom is in delivery or post-delivery, there's a stigma. We know that there's a stigma that exists. So how does this stigma affect the experiences of Black fathers during that time?
in a couple ways. So if you sort of repeat this data about how many dads are missing, there's sort of an expectation that he won't be there. And if he's there, there is also a lack of knowledge about how to engage him effectively, because he's not supposed to be there. He's invisible, right? So when fathers are there, the stigma about their involvement or lack of involvement influences how people treat them. And so if he's there, you can sit over there in that chair and be quiet, Dad. But when fathers are actively involved in what's going on in the room, practitioners are sometimes uncomfortable with that. It's just like, wait, first you're not supposed to be here, and now you're talking. So that makes it really challenging for dads to be there, to be support persons, to be advocates, to look out for mom's welfare. And then the other part is that the stigma and the stereotype influences how people react to fathers asking questions. So if a Black father is in the room and he's saying, why is that monitor going off and what's going on there, you're likely to get a response like, it's okay, Dad, you don't want to upset Mom. It's okay, it's okay. It's just kind of like placating them and like kind of putting them back in their corner.
Instead of answering their question and explaining what's going on.
And then if you, by chance, have a father who is really persistent about wanting to know a certain thing or expressing his concern about a certain thing, Black men in general have this stereotype, our stereotype for, oh my goodness, he's raising his voice.
He's angry.
I'm scared, let me call security. So if a dad is in the room, in the hospital room, supporting his partner and really doing what else do you want him to do, right?
Right.
And if a care provider is perhaps unfamiliar with that perspective, uncomfortable with that perspective, it's like, oh, let me call somebody for support or let me call somebody for help. So that stigma and that stereotype goes all the way through fathers' experiences in the hospital, they're not used to being seen in prenatal care visits. So when mom goes to see the doctor, she's pregnant, she goes for an ultrasound, it's like, oh, who is this person with you? So it carries throughout the pregnancy experience. And I think we are trying to move in the direction of recognizing what we're doing, but we have a lot of work left to do.
Absolutely. I'm going to follow up with that and ask you, is there something that Black dads can do to make the experience a little bit better? You know what I mean? Like, is there something that they can just have in their toolkit when they're preparing for birth to make this experience go a little bit smoother?
They can be there from day one. So recognize that their presence is important. So don't let anybody tell you that you don't need to be here, that why go to a prenatal care visit with your wife, your partner? It's fine, it's just, the doctor's gonna check her out. But what fathers specifically can do is learn about risk factors and what do you do about that. Because I don't think, but this is to be explored with Santosh in our human-centered design, how much do fathers know about the potential risk?
Right.
So if you're sitting back and you say, she's pregnant, it's gonna be fine, 9 months, we're gonna have a baby, all is well. But then if you know that so many moms are really having near-death experiences, some moms are actually dying during pregnancy and childbirth, I think it raises the level of awareness and engagement, and then give fathers specific information. These are the things you look out for. If mama's experiencing this, go straight to the emergency room. Don't let them say it's normal or it's okay. If you need to print out that CDC guideline that says these are the risk factors and this is what you do, show them that. Because an aware consumer is a consumer that's going to be listened to and that's going to be recognized for the fact that they know things. So helping fathers understand that pregnancy is just not just a routine thing, not for Black women.
Right.
And then what you can do about it, what to recognize and think about even before, during, and after birth, because a large number of mothers also die after they give birth.
Yeah, we talked about that on a previous episode, that postpartum period being up to a year after delivery. And that's something that dads should be aware of, because whether you're in the home or not, you're probably around mom the most, especially during that first, that postpartum period. So basically what you're saying is be educated and be aware. That's the best way to be prepared and kind of combat this stigma.
And be prepared to be vocal. Be prepared to speak up.
So one thing I would add to that is, as Dr. Julian said, the services have all been designed with the mom in the center of the design.
Absolutely.
Which is great. That's what it should be. But like any good service design, it's about making sure that everybody has a voice and everybody has a ability to speak and knows how to speak or what to say. And that has been missing in this. So dads have never been given that opportunity, or never been given that, for lack of better words, a toolkit of what to say and how to raise an issue if there is an issue they notice.
Right.
Like, we do better job of designing order of a latte at a Starbucks or a Dunkin' Donuts than about enabling a family to get primary health care, especially about maternal health. So we need to be able to say, if we can do a good job of designing a coffee service, why are we doing such a poor job of designing a maternal health care service? With fathers, with the grandparents, whoever is there, right? Everybody needs a voice.
Right.
Why is this service so hobbled with stigma and stereotypes? So we need to be able to answer that. And the approach that we are taking, the one studio we have done so far with fathers and community members on it, was last month, right? Like, we did the Black Maternal Health Week event where we had people, and one of the biggest outputs was that, how do you create a tool which we can give to the fathers, to Dr. Julian's point, so that they can speak up when they need to.
Right.
Because right now they don't know how, and if they speak up, they get
criticized or
stereotyped as
stereotyped.
you are that angry person. But no, they're not angry, they just don't have a tool to say what they need to say.
Right.
So how can we negotiate that gap or chasm of not having a tool is what we are trying to deal with as human-centered designers in this case.
Absolutely. That's good. Yeah. So it's an ongoing issue.
Yep.
So before we go into this next question, in observance of Black Maternal Health Week, we interviewed Dr. Janelle Bolden of Northwestern Medicine, and she helped us digest a report from the Illinois Department of Public Health. The Illinois Department of Public Health reported that Black women are 2 times more likely to die from a pregnancy-related condition than white women in the state of Illinois. Please explain to our audience what father-inclusive prenatal care is and how implementing this care model can positively affect disparities in Black maternal health.
Thank you, Jazmine. So actually, according to federal data through the Centers for Disease Control, Black women are 3 times more likely to die from pregnancy-related complications during or after childbirth, as you mentioned, up to a year later. So I think sometimes that's startling revelation, because typical is you have your baby, you have your 6-week checkup, and then you go back to work, or you go stay home and take care of your baby, or whatever you do. But the recognition that Black women continue to die, not just Black women, but Black women more predominantly continue to die up to a year later, is just that statistic that is like, wow.
Yeah, astonishing.
Right, wow. And so I'm currently doing a project that's funded through the Department of Health and Human Services called Father Inclusive Prenatal Care.
Okay.
And what we aim to do with that project is key in on the dads. So we are recruiting mothers through their prenatal care provider we're pulling in dads to make sure that they are a part of everything, and we're giving them father-specific information. So,
I love that.
thank you.
That's awesome.
How do you care for mom before birth, in labor, after delivery? How do you support mom? What do you need to know about caring for your baby? Because again, with the stigma and the stereotypes, it's like, oh, dad doesn't need to be there. He doesn't need to do this. You can hand mom a diaper, and that's it. So, in recognition of some of the things that have been done, particularly in newborn intensive care, when mothers have been perhaps sick and baby is in the hospital, in a lot of ways, the newborn intensive care unit has moved past the OB unit and done things like have fathers do skin-to-skin care, skin-to-skin contact, literally unbutton your shirt, plop the baby in there, button your shirt back up. And that connection with recognizing that babies need contact and need love and need support, and that dad can do that is just such an awakening experience. It's like, oh my goodness, I can really play a role in my child's development and help my baby recover and all of those things. And so our grant focuses on helping dads understand what's going on in the prenatal space, how to be in that space, what to say in that space, but also giving dads specific information about what they need to help mom raise this baby and support this baby. It also focuses on communication between couples because they're
Important.
yeah.
Absolutely. I didn't even think about that until you said it. That is very important.
Because although couples may not always be a couple, they're going to always be their child's parents.
Exactly.
So you have to be able to, we've broken up, we've got divorced, we're not together anymore, but you are still that child's parent and a part of that child's life. And so what does that mean? That means communicating effectively with the mother. So that's a component of our program. And the funder, actually, Department of Health and Human Services, built in another component to all of the grants they funded, which is workforce development.
So helping dads get jobs or find work?
Helping dads further or shift or change their education. It's like, I always wanted to do this. I didn't get those skills. We can connect them with services. There's a program in Chicago called Skills for Chicagoland's Future, which is our partner on the grant.
Okay.
And we refer our couples, well, particularly our fathers, to that. They can get work with assistance with building their resume, with applying for school at another place, pursuing job opportunities. And so this isn't something that's relevant for every dad, but for the dads who need it, that's something that we're really excited that that's a part of what we do.
That is so exciting. You know what? There's a word that popped in my head as you're talking about this: empowerment. Just empowering dads with the knowledge that they need to be who they need to be for their child, for their family. And it's amazing. It's amazing. I didn't even realize, I'm aware that there is stigma, but I didn't realize to the extent, it's bad, So I love what you're doing, and like you said, the approach goes far beyond being at the hospital. It goes, what do you want to do with your life? What do you want to do career-wise? Because this baby is here, and the baby ain't going nowhere.
And this is part your baby. Yes.
That's excellent. Okay, moving right along. Our next question, it may get a little heavy, but we have to address it. How can the community embrace fathers who have experienced loss?
I think this is part Santosh and part me, because when the word community brings to mind people inside systems, healthcare systems, healthcare providers, and it also brings to mind community, family members, church members, whoever's surrounding the dad. And first, the recognition that when mothers have near-death experiences or actually die, a lot of the times fathers are left with that grief. So now not only have they lost their loved ones or seen her in the hospital for extended periods of time, they also have this baby.
Right.
So who's going to care for this baby?
Right.
And at the same time, recognize that men may not go through the grief process the way that everyone else does, but they do experience the grief and the heartache and the pain. So first is the recognition of who's being left behind and what that person needs. And then how do you find out what that person needs?
Cool. Yeah, to elaborate on that human-centeredness of that, as Dr. Julian said, everybody experiences grief differently. And I'm going to give a shout out to our favorite documentary here, The Aftershock. Right? So I really feel like if anybody's interested in understanding what happens to the family when the mother of a child passes away, please check out the documentary Aftershock. It's very informative on that, on how the grief process unfolds on the person, their friends and family, and the community. So it's almost like layers in which that wave, and that's why they call it the aftershock, like how it propagates. So a lot of work has to be done to understand the journey of grief by the individual, the family, the friends, and the community. And accordingly, the resources will have to be dedicated and created and dedicated, actually. So we are really trying to understand the process of what the fathers would need help with and what are they willing to try first, so that then accordingly we can start designing some of those solutions. So it is about understanding the journey through grief and then creating the touch points that will help alleviate the grief or help them handle the grief. And I'm going to steal one more phrase from you, Dr. Julian. It's all about enabling the fathers to take action for themselves. So it's not like we are holding the power and we're going to empower them. It's all about they have the power, making them realize they have the power to make the changes, and then giving them the tools and enabling them with the tools that they can use. So if you want to add more on that enabling part, please feel free to do that.
Well, my favorite way of thinking about it is shifting power. So I think the word empowerment has been around for a while, and it a little bit sort of leans to, I have the power, but I'm going to give it to you. But who said you had the power?
Right.
So that idea of shifting power to its rightful owner, if you will, is how I like to think about the whole human-centered design piece and getting fathers involved in this. And the other thing is that one of the other major stereotypes or issues that people, when they think about grief, is that, you know, oh, it doesn't bother men, they hold things in, you know, it's not a acceptable thing to do for men to cry and all of those things. And it's something we start doing to young boys.
Yes.
When they're little. Don't cry. Don't stop that. Don't cry, because, you know, you're a man. Don't cry. You know, and as that is instilled in people throughout their lives, what are they supposed to do with this grief and heartache if we've told them that they can't express it?
Right. Right.
So that whole piece about grief and loss and what we do to men and to Black men and the whole issue of, you know, you got to be a man, you can't show your pain and suffering is like, why does that make any sense?
It's crazy. It's crazy.
Unfortunate, but yeah, true.
Yeah, it's very unfortunate. You know, I think about like young Black boys that I've been around and seeing their fathers tell them, you better stop crying, you know, and it almost makes me cringe because I'm like, this is a 2-year-old baby. Like that's how they, that's how they communicate. So, I don't like it. I don't like it at all. And it definitely, it's like we beat into their minds from babies that you can't show emotion. You have to suppress emotion. And then now as adults, we wonder why. We wonder why people get angry or why they raise their voice. They've never been taught how to communicate their feelings, especially feelings of grief and sadness. So it's a whole, we got to go back to
a vicious cycle going on.
Yes.
We need to break that vicious cycle.
Yes.
That's exactly where I would land.
Wow. Okay, so following up to that question, what kinds of resources should exist to help families facilitate the grieving process while also parenting a newborn? You guys kind of touched on this a little bit, but if there's anything specific you would like to elaborate on.
Well, I think in terms of resources, this is going to be our theme song today. Talking to fathers. Mm-hmm. What do you need? How can we help you feel comfortable expressing what you're feeling? What kind of environment would you like to be in so that you can voice how you feel and not be judged in some negative way? Mm-hmm. So again, we're circling back to our central human-centered design piece. Is like, tell us how to do this.
Right. Tell us what you need.
Yes.
Right. Absolutely.
So to belabor that point, I guess we don't want to sympathize with the fathers. We want to empathize with them. Mm-hmm. It's a subtle difference, and it's a very important difference, because sympathy is like, yeah, we feel bad for you. We're going to educate you how to deal with sadness. The moment you say we're going to educate somebody, that means it's not going to work that great, because we all know how much knowledge is out there, but how many of us get educated really, right?
Right.
But if you have the empathy and you design with them in mind of whatever the solution is, then you have a better chance of actually connecting with them where they are, and giving them the support that they need and that they will use. And the biggest part about co-creating the solution with the fathers is that there won't be a barrier in them adopting it. Because if they create it for themselves, they'll adopt it smoother, adopt it faster, adopt it more efficiently. Whereas if we create an intervention sitting in our ivory tower and say, here is a solution you should try, right there is a disconnect, right?
And why should I?
Right, exactly. How do I know that this is going to help me if I wasn't a part of designing it?
Yep.
Yeah. Next question. What changes can be made to better integrate non-residential and residential fathers into the process of caring for the baby and mom?
So speaking of educating, I think the group that we need to really kind of hone in on in terms of best practices for people in clinical settings is giving this information, is sharing this information about what they can do better. Because I don't believe that any practitioner, or not for the most part, most practitioners are not out there doing work thinking, so what if it doesn't work?
Right.
And so they are doing what they've been taught to do. They're following practices that have been handed down, that have been considered being evidence-based, but evidence-based on who they talk to may not be, exactly where we would like to see it. But I think the more information we can give to people who provide care for families, the more likely we are to start to see some differences in how people think and how people engage and how they react. It's more understanding from their perspective, and to help kind of wash out some of these stereotypes about people who you've never listened to.
Right. Cultural sensitivity is so important, especially when training practitioners. before they're even practitioners. You know, they need to be sensitive to different cultures and, you know, how women versus men process grief, and, you know, understanding that healthcare is healthcare of the whole person, including their mental health, in addition to their physical health.
And not just healthcare of the whole person, but healthcare of the whole family. So if you're leaving out the father, thinking that he's not an important piece of this equation, you're leaving out a significant portion of who you should be engaging with.
Absolutely.
Yeah.
Absolutely. Awesome. Okay, can you talk to us about the Building Bridges to Fatherhood program and how initiatives like this help non-residential fathers to be engaged in their family's care?
Yes. So Building Bridges to Fatherhood was a program funded by the NIH to develop an intervention for African American dads who don't live in the home with their children.
Okay.
And the first thing we did was pull together an advisory council of African American dads who don't live with their children. And literally, the grants funding was to meet with these dads and develop this program. So we weren't testing it, we weren't evaluating it, we were creating it.
Awesome.
And we worked for 2 years to do this.
Wow.
We met with fathers about every 1 to 2 months. We discussed what content they felt should be in the program. The fathers in that advisory council named the program. They decided what the name should be.
I love that.
And they also decided what the content should be. So that particular program is videotape based. And so the intention is to meet with fathers in a group and show video scenes of fathers and children interacting with each other, or maybe fathers and mothers interacting with each other. Show the short scene, stop the video, and ask dads, what did you see happen in this video? What did the father in this video do well? What could he have done differently? Has this ever happened to anybody that you know, or even happened to you? And so that's how the entire program is structured. The really fun part of developing it was that we hired father and child actors from the community who were in the videos. Our advisory council helped us develop the scripts about what we wanted to happen in those videos. And we also built in pieces that we feel will resonate with fathers. And I'll just give you one example. So in terms of parenting, a practice in the parenting literature is a concept called timeouts.
Okay.
And so from a cultural relevancy standpoint, that may or may not resonate with moms, but it definitely didn't resonate with dads.
Yeah.
So we asked our dads, how can we help this resonate with fathers? And they gave us a sports analogy. And it was called putting your child on the bench.
Okay.
So,
Okay.
so when you think about, you know, a baseball game, basketball game, whatever's going on, if the player is out there not doing real good, making a lot of fouls, making a lot of mistakes, the coach is like, come on.
Sit on the bench
Put
for
you
a
on the
few
bench
minutes.
for a little while, right? Put somebody else in the game. And we talked about putting their child on the bench and having that be an opportunity for the child to kind of get themselves together. And of course, you know, a good player is not going to be on the bench for a half hour or for a whole day. So it's just, you know, depending on the child's age, it's a few minutes just for the child to regroup. And then you got yourself together, you're good, okay, back in the game. And so that connected with the men that we were working with. So those were the types of things that we did with the program to make it one that fathers could relate to. And so we got the program developed. There are 12 sessions and 3 units. And the first one I think is really essential. and it's called Fathers Are Important. Because Black fathers have heard for so long, so what that you're not there? It's okay. Mom is doing great. She doesn't need you. And while single moms do a phenomenal job of raising children, imagine if you had some backup.
Right.
Imagine if you had support and you could be like, okay, you take this kid for a while. I need a break.
Right,
you know? And really impressing upon fathers that don't listen to that noise out there that you're not important. So fathers are important. The second unit is about parenting, which gives fathers, this is where that putting your child on the bench strategy fits in. Like, what are some strategies you can use to deal with your child's misbehavior? Because children are going to misbehave. And then the third unit is really focused again on communication and problem solving. So if you and mom are not together, if you and mom are having questions and concerns about spending time with the child or being available to the child, how do you have those conversations in a way that's effective and productive? And so that's how building bridges to fatherhood came to be.
I love that. The sit on the bench analogy is everything. That is gonna like stick in my head forever. But it took for a dad to come up with that, which is why it's important to do the human-centered design. going back to that again. So that was the last question on my cards, but I have a question.
Yes.
Before we close out. So as you were talking about dads being told it's okay that you're not there, I thought about moms and single moms saying that and feeling that I don't need you. You know what I mean? I'm good without you. I'm doing good without you. What can mothers do to help facilitate this family bond and this togetherness, even though the dad does not live in the home?
That's a super important question. And we have, I think in the communication and problem solving, we have content about that, is helping mothers recognize why fathers are important as well. So what does it mean if the father is here? How does that benefit my child? How does that benefit me? And so there's content and information about talking to mothers about that very concept, is that while both fathers and mothers bond with their children, men just have that little special something that's different than what mothers do. They don't, the way that they talk to their children and what they say to their children encourages their independence. So the dad can say, you got this, get on out there, and in a way that supports children to say, okay, I got this, let me get on out there. And the perspectives are complementary. So they go together and create a whole package for what children need. And so part of that is talking to moms about why fathers are important.
Absolutely.
And so then the only other thing I want to add with regard to fathers is the something that's kind of referred to as the intergenerational transmission of father absence. So what that means is sometimes when we're talking to dads about why they're important, you have a father who may or may not have grown up with their own dad. And what has that experience done for them and to them? And you may get a couple of options, but really if I were to kind of just pair it in half and think about the two options, there are dads who may think, my dad wasn't around and I grew up without him and I'm fine.
Or so you think.
Say.
Right.
So there are components in those videos where we have those scenarios where we are talking about that father's experiencing, like, my dad wasn't around. And then the other side of that is that you have fathers who say, my dad wasn't around for me, but I'm going to be there for my child. And then, of course, you have the area in the middle, where people are kind of on both sides of that. But that was something that we learned from fathers was important, and we included it in the program because it takes away some of the personal impact if they're seeing it on a video and somebody else is doing it or somebody else is saying it. You can just see wheels turning in their head. It's like, oh my God, I'm on this side of the street, or I'm on this side of the street, and I need to be getting in the middle of the street. So that's something else super important that moms, you got to talk to moms.
Yeah, absolutely.
Because in a lot of ways, moms are the gatekeepers.
That's true. That's true. Dr. Santosh, you got anything to add?
So I'm going to go back to the analogy of coffee making, I guess.
I love your analogies.
So in service design, we talk about optimizing the service for all stakeholders, right? The service consumers and service producers as well. So same thing in this case, right? Like even if fathers want to have a role, if it is not being complemented by acceptance of that role by the mother, we still are at a stalemate. So to Dr. Julian's point, we'll have to design awareness of what that role's importance is for both parties, right? Like for the mother and the father.
Right.
And then figure out where the joint optimization or joint benefits are for both of them. So we will always have to answer the question, what's in it for me, for each stakeholder? Be it the person who's making the coffee or be it the person who's drinking the coffee.
Right.
So in this case, we'll always have to answer that question. And for example, we did a session in West Garfield Park with seasoned citizens.
Okay.
And their thing was, oh, I have so many solutions for the problems I see in my own household, but my kid is not listening to me. And they are living in the 3-generation household, right? The grandparents are taking care of the grandkids, and either only the mom is there or the dad is there, and somebody is missing. And their challenge was always communicating with that, either the person missing or the person who's there and still not listening. So if you think of even their role in this, we do have to bring them to the table, and we'll have to understand how will they understand the need for fathers to be present, and how do we enable that, the mothers and their acceptance of fathers, and that the fathers saying, we will be there, we will show up, tell us how. So it's like a trifecta we'll have to execute.
Excellent. Wow. You guys have given me so much information. Thank you so much for sharing your expertise with us. Thank you for talking about your research. And you've given me some terms that I need to go and Google now.
Hopefully not too much.
No, it's great. And I hope our audience will, look into some of these things and just continue to educate yourselves on this topic. And happy Father's Day, everyone, to all my dads out there. And be sure to like and subscribe to our YouTube channel. You can catch us on Facebook, Apple Podcasts, and Spotify. We'll see you next time on Thrive Alive.
Thank you. Happy Father's Day.
Happy Father's Day.